everybody. Welcome back to welcome back. This is the first episode of Health Explained Show. And I am so excited that we have Dr. Linda Ciavarelli with us because she is the inspiration behind this show. And we're going to figure out why are we calling this the Health Explained Show? So first of all, let me welcome. Hi, Dr. Linda. How are you?
Hi, Dr. Betsy. Thank you so much for having me on here. I'm so excited. I can't wait to get started. I can't wait to hear about all the health explained that we're going to be talking about today.
Yeah. So what is it that you are an amazing podiatrist, but not just that. You are the co-founder of an amazing new company called House Call VR. So I just want to have you take a minute and explain what is House Call VR and why did you form this company?
Oh, wow. It's been such an amazing journey. Thank you so much for asking that. House Call VR is something that is so near and dear to my heart. 20 years I've been in private practice as a podiatrist, as you mentioned, and I've really seen how people struggle to understand their health. And I struggle as a provider to explain things to them. Things are really complicated. The more we learn about medicine, the more we know, the more complicated things are. Also, we have less and less time to explain things with our patients and to really get into things. It's really frustrating for everyone involved. Most of the time, people leave their doctor's office with more questions than answers. Maybe they get some papers or a brochure, and most of the time they go home and they just Google it. That's a pretty universal problem. And what I think is, and not just me, we found that immersive technology, so using virtual reality to explain things to people, is a really great solution. So what House Call VR is doing is we're focusing on virtual reality patient education. We're creating a clinical application that can be used in a doctor's office or in a hospital. So imagine the next time you go see your doctor or one of your kids' doctors and they have an issue or they need to do some preventative things or they need a medication. Instead of just explaining things or drawing a picture or pulling out the plastic heart or looking it up on Google, you actually have the opportunity to sort of magic school bus inside of that and really get a better understanding, a deeper understanding, to really give people that agency. People want to know what to do about their health, about prevention, about care, about treatment. That's really what they want, and we really want to help them with that. So that's what House Call VR is doing.
And I love it because I know even myself as a doctor, if I as a patient go to a doctor and it's not in my specialty and they start talking and I'm like, what are you saying? Like, I know I've gone home and done the Dr. Google, like, what is this that they're talking? And like, we know Google can lead you down a road that can be pretty scary and there's a lot of misinformation. So
and that's super frustrating for everyone involved. It gets really scary because you just don't have the context. I mean, we've all had an experience where something's going on. The first thing we do is we Dr. Google, or even after we go see the doctor, we Dr. Google. Now we have a diagnosis, we Dr. Google, and inevitably we're dying, right?
yeah.
Inevitably the worst, because all of the information has to include all of the possibilities, and it's not really in any kind of context. This immersive technology, and especially to be sort of prescribed by your doctor. So your doctor says, I want you to experience this specific information in this totally new way that we know is more efficient, faster, and stickier. People really understand things better when they experience them. And that's being shown using immersive technology, using virtual reality.
I think the other thing that's important is not only if we understand our medical conditions that we can take care of ourselves better, but we're going to save money, because that's crazy. I'll have you talk about how this is affecting our wallets.
Yes. So health illiteracy, so that's defined as the inability to understand, interpret, and act on health information. It's actually really prevalent. So some studies show that up to 9 out of 10 people are at times health illiterate. Now, does that mean 9 out of 10 people don't understand what the doctor's saying? No. What it means is that when you're in a situation where you're in pain or your family member is in pain, or there is some kind of new diagnosis, that it's so overwhelming that we just can't understand what the doctor is trying to tell us. It's too much. So we know that 9 out of 10 figure really impacts people, and it also impacts our healthcare system. Something like 17% of our healthcare expenditure is lost to health illiteracy. So think about what that means. Like if we're looking at almost a fifth of our expenditure that we're spending on healthcare is being wasted because we're just not able to reach patients, or what we're doing, brochures and Dr. Google and plastic hearts and pictures drawn on paper, aren't really getting through to patients. And that's really costing the system an incredible amount of money, not to mention time value, personnel time, repeat visits to the doctor, repeat visits to the emergency room, things like that are entirely avoidable.
Yeah, it is just crazy how much this impacts. And we were even looking at what was it, the average time that a doctor has with a patient, like only 15 minutes. And
It is. The average time is around 50. It's actually 15.7 minutes. And that doctor has to go over 6 topics in that 15 minutes. And on average, they spend 5 minutes on the first topic, and the rest of the topics get a minute. That's not enough time. That's not enough time to go through this, even over multiple visits. There's just not enough time. So now imagine we have a tool where the doctor can actually leverage this tool, say, look, I'm going to explain this to you in one way, in my way, but maybe you can have this experience. You can put this headset on, you can have this totally new experience where you have the opportunity to really understand. That gives the patient a better footing. We're always talking about in House Call VR, creating a universal language between patients and their doctors. And that's through experience. That's how we learn best.
this is amazing, and this is going to make such big change in the world. In the meantime, until that's all ready, we have this show, which is going to be so much fun because we're going to be interviewing different experts and finding out how they explain things to their patients, which I've been finding super enlightening, and I'm learning along the way. So, as a podiatrist, I'm sure there are topics that you have to explain to patients all the time. What is one that you explain in a creative way?
So one of the most challenging topics that I'm always talking about has to do with diabetes. So with diabetes, there's a lot of diabetics that come see a podiatrist, and they're, like, why am I here? Why do I need to see you? There's a lot of preventative care that happens. One of the most common complications of diabetes is something called neuropathy, and it's the loss of protective feeling in your feet. And, you might say, well, what do I care if I can feel my feet? What you can do is you can step on something and not even know it. So that's a lot of information just right in that little space. So how do I help my patients? One of the ways that I help my patients understand this is I talk about our nervous system like the electricity in a house. And what I talk about is I say, how you have the electricity in a house. Now, let's say the siding comes off and there's some water damage on a side where the electricity is. Those lights in that room might actually flicker a little bit. Maybe the lights are a little bit brighter. Maybe the lights are a little bit dimmer. And that's exactly what happens with neuropathy. The bright light is pain, and the dim light is numbness and tingling. And so that's like one way that I help people understand what's going on in their body with their nervous system and with neuropathy.
I love that because not only like you get a real visual with that, and it's like I never actually thought about your nervous system like electricity before, and I'm like that is really helpful. So I love that. This is going to be making such a big impact in the world. And how do you envision your platform in the future helping people or potentially, I know you talked about it a little bit, but how do you envision it to be incorporated in the future?
So we love to use this expansion of technology, right? Like we've communicated throughout human history. We've communicated in a variety of ways, right? We communicated through language and speech and stories. And then we started drawing things, and that sort of transcended time. No longer did you have to actually be in front of someone to share a story. Imagine like a caveman or woman drawing on a wall telling a story. Then we moved to all of the different ways, written and video, and where we are today, but that's all still two-dimensional. Right now, with immersive technology, meaning to go within something, to put on VR headset and goggles and to really go within something, we have this whole new way of sharing information. So what we see House Call VR doing is using that whole new way of sharing information to help patients understand their health better and to give them more agency, and to do it at every touch point in the healthcare system. So imagine you go to a pharmacy, you've been prescribed a medication. Instead of sitting there scrolling on your phone or looking it up on Dr. Google or whatever it is that you're going to do, you actually have the opportunity to go into your body and to see how that medication is working and to show why it's so important to take it. So that's one of the ways that we see this happening. Of course, there's no end to what we can teach. And that's what's so amazing in healthcare, is that there's so much opportunity. So what we want to do is we really want to give people that agency to understand and act on their health better, so that they can be better prepared. They can also prevent disease. They can take care of their bodies. They can care for disease, take their medications, and really have that universal language to talk to their doctor. So imagine you learn about a disease before you even go see a doctor, right? While you're in the waiting room, you can walk in there and have a totally new understanding and be able to ask so many more questions and really deeply understand what's going on. So that's what we see for our future.
And it's kind of almost like a translator in some ways too, because we don't realize as doctors, we've been taught this whole language of medicine, and it's what we speak to each other every day. And sometimes I know I myself have gotten stuck in, like, I don't want to use this term, but I don't want to dumb it down, but it's not dumbing it down. It's translating it into a language that's understandable, instead of just throwing these medical terms at people that they're just, they glaze over. They're like a deer in headlights. They're like, what are you saying?
And visual and experiential knowledge is universal. So when you experience something, when you are within your body, seeing how it works, seeing how medication works, it doesn't matter what your language is. It doesn't matter what your reading level is. It doesn't matter if you understand medical terminology or not. You actually can see it and experience it. And that's really, to your point about it being a translator, that's what we want to do. We want to translate all of that knowledge and share it with our patients. People want to know.
Yeah. And I think, I'm always like, knowledge is they say knowledge is power. And I'm like, that's definitely the fact, because if we can understand and take control, and that's the other thing, I think it gives patients control back, instead of, because when you're sick and you're getting terms thrown at you, especially God forbid, if, you hear the word cancer, there's a lot of loss of control and panic that sets in. And this will give people more control, because when you understand it, you can interact with it on your own terms. So
Exactly. And that's what we see for our platform, that what we'll have is virtual reality glasses for patients in the healthcare setting, but then have a smartphone app where they can actually go home, show this information. Now it's still 2D, but it's not completely immersive, but they can share this information with their patient, with their families, with their caregivers, so that people have an opportunity to understand this better, and that it's specifically prescribed by your doctor. It's not just generalized information. This is information specific to you, to your condition, to what it is your doctor wants you to know about that condition.
So this is great. So this is going to be something that's actually coming from the healthcare system as opposed to like, oh, let's just go to WebMD or whatever. Can't remember all the other ones that are out there.
Well, they do a great job in print,
Yeah.
but it's print. And that's not the best way that most people learn. The other part of it is that it's so general, that's like the pharmaceutical commercials. You hear a commercial about new medications, and then you hear the guy not to be used like that. It's overwhelming, and you don't understand what's the important pieces. That's exactly what house calls working on, is finding those most important pieces that your doctor thinks that you need to know, and they can share that with you.
This is exciting. I can't wait till, this is full stream and in effect. And I know you're doing some amazing work on this. And in the meantime, we're going to be getting this show out where you're going to be able to hear from some amazing experts. I'll give you a sneak peek. I already interviewed 2 experts before we did this interview, and they were talking about like things like insulin resistance, cardiovascular disease, and even as the interviewer who is medical, I'm like, wow, I never thought about that condition in that way. And that makes so much sense.
And that just goes to show you how much we in healthcare have needed to rely on metaphors, because we're doing our best to translate. But what we're doing is we're really relying on the patient's imagination and our communication skills. So if we can take that out of the equation, where we have these great metaphors, we have these great understanding, the ability to really explain this in this like new and novel way. And people don't have to be like, okay, let me put on my imagination hat and try to imagine all of this in the middle of trying to do all the other things that we have to do around our health. Take that out of the equation and really allow people to focus on what's the most important thing, which is keeping their health well and dealing with any health problems that come up.
Oh, this is wonderful. Thank you for taking the time to be with us and explain this stuff today to us, and looking forward to, what's coming in the future with you and with their company and with the show. In wrapping up, is there anything that I didn't ask you that you think is important for us to know?
I think the most important thing is that people want to have an active role in their health. And the healthcare system today has many flaws in the United States and elsewhere. That's one of the places where we're really failing, and we can do better. And at House Call VR, we're really focused on exactly that, giving people the knowledge that they really need and want to make the best decisions, because you shouldn't have to be trying to find the answers to health questions on Google and other search engines. You should be focused on getting better, keeping your health well.
Awesome. And in the meantime, I know this is not available yet, but it's coming. But in the meantime, where can people find out more about you and more about House Call VR?
So you can find us on all of our socials. We're on Facebook, we're on Instagram. Also, our LinkedIn is fairly active. We do all kinds of fun and exciting things. We've hosted the first public medical lectures in the metaverse. Recently, we did a lecture about diabetes from inside of a virtual reality pancreas. We did a talk on addiction from inside of a virtual reality brain. So we're always doing crazy, fun, awesome things. You can also find us on Meta's Horizon World social virtual reality platform.
Awesome. Thank you so much for all the amazing work that you're doing. And thank you for taking the time to talk with us today.
Thank you so much, Dr. Betsy. And I'm so excited to hear about the metaphors and the way that providers are already sharing this information and really helping to translate what it is that we're talking about in healthcare.
Awesome. So everybody go make sure you check out House Call VR on social, follow them so you can keep up to date with what's going on, what's developing. And while you're there, go check out wytv7.org and look at all our other great programming. Make sure you follow this show because we're going to be dropping some amazing information every week for you. And give me a follow too on social. I'm Dr. Betsy Greenleaf or Dr. Betsy Greenleaf _. And also, don't forget to come back next week for another episode of the Health Explained show. All right. Thank you so much, Dr. Linda.
The best things in life are the people we love, the places we've been, and the memories we've made along the way. Don't let your pelvic health get in the way of your life. The Pelvic Floor Store, your resource for personal health.